my opinion, generally, I think one of the best places to practice as a health-related professional is the rural communities, because job satisfaction is excellent. You see the impact of the care you're providing directly. The staff here generally, they've been here for quite a long time. They know the patients very well. They know, how to access resources very quickly, and you're not on your own. And I think, my personal experience has been excellent, and I think generally, a lot of the students coming here, I think that's why a lot of them, I've interacted with them over lunch, and they're amazed about, they didn't know this was available in the rural facility, that they can have, well-functioning emergency services, well-functioning acute beds, well-motivated staff who are just, whose whole idea about is, centered around providing good quality patient care, spending enough time with the patient, making sure that the patient gets excellent care and that they can recover or go back home or go to an alternative living environment, wherever that suits their needs.
I've learned a lot. They're very thorough with explaining different procedures, although lots of stuff that we've been doing, like intubating and interosseous injections and stuff, are not in the nurse's scope. It is interesting to learn more about that and expand my knowledge in that regard. And they are so welcome with questions, and I don't know, all the different stations that we've been to, I've learned a lot. And just because it's not in my scope, I think it's still important for us to know.
It is a little bit more scary being a rural nurse because you need to have a wide range of skills, but it's exciting to be able to learn those skills and to work with a team, because I think you are more independent, and you need to have a little bit more responsibility. And I just love the feeling of a rural community, because you know everybody and you are more tight-knit.
It's only been one day, but we do get multiple opportunities to go to rural areas. And I think being exposed to it over and over again and getting a good idea of what life is like in a rural setting, I can say for me personally, it is something that I'm seriously considering. And I wouldn't have considered otherwise if we didn't have the chance to get exposed and actually see what it's like.
With the rural skills, it helps us get exposed to all these communities. And later on, we get to network with the people here, and later on, if we want to shadow, we get those opportunities. So I feel like having the first step to being open to these areas really helps us decide whether or not we want to do rural.
It's a great opportunity to get students that are just kind of entering the medical field to experience what rural medicine is all about, and to help them kind of gauge whether or not they want to be involved in a rural practice after they get done school. So I think from our perspective, that's why we're so excited about having the rural skills out in Oyen, and it can help spread the message throughout some of the other students that maybe didn't attend here. If they have positive experiences, they can kind of carry that message forward as well.